Welcome back, everyone. When it comes to kids and the dentist, it might not be something many parents think about until something goes wrong. In fact, most kids don't see a dentist until they're at least 5 years old, and that could be a problem. So here to talk about this important issue, and actually a conference that's happening next week to talk about the latest in child dental care, Dr. Lisa Jacob with Dell Children. Thank you so much for being here.
Thank you for having me, Alicia.
Okay, so let's talk about this, because when should a child first go to the dentist? Is it their first tooth? Is it all their baby teeth? What do you recommend?
The American Academy of Pediatric Dentistry and Pediatrics recommends that a child be seen by the first year of age. A tooth usually comes in between 6 months and 1 year of age, and we want to get them started when that first tooth comes in.
Okay, why do you think it's important, though, to establish a good dental health so early on when the kids are so young?
Because starting good habits early will last for a lifetime. So if they brush every day little, they'll go ahead and do that when they get to be older.
And talking about these habits, I mean, sometimes kids just say, I don't want to brush my teeth, I don't want to do it. Do you have tips for parents, you know, to say, do this so that they associate it with maybe something fun or something to do that they look forward to?
I think brushing with your children and showing them how important it is. You can use music, you can use your iPod, brush for 2 minutes a day, use a little bit of toothpaste. So the American Academy of Pediatric Dentistry recommends just using a right-size amount of toothpaste for children that are under 3, and a pea-size amount for anyone that's over 3, and brush together and enjoy it.
And it's not, and like you said, it's not something that is simply just brushing, though. Going to an actual dentist can make the difference, right?
It's really important to start early because the kids get more comfortable sitting in the chair. Not only are we checking their teeth, but we're starting a lifetime of good habits of them coming to the dentist and having positive experience. Dental decay is the most preventable disease that's out there. So if we can prevent them from ever having a problem, they'll continue to have good visits for the rest of their life.
What are some of the biggest mistakes maybe that you see that parents, I guess we should start with, parents make and kids make that kind of hinders this process?
A lot of people don't know that you can actually start dental health early before they even have teeth. So you can take a wet washcloth with a baby that doesn't have teeth, wrap it around your finger and wipe their gums out, and you start very early. When their first tooth comes in, you can start using a little baby toothbrush and brushing their teeth. And the biggest thing is diet. Make sure they have healthy foods. A lot of children, it's not just what they eat, it's also what they drink and how often they do it. So chocolate milk, orange juices, all of those things have a lot of sugars in them, and they sound so good for you, but they really do have a lot of sugars. 4 to 6 ounces of apple juice, orange juice a day is what's recommended.
Okay, that's good to keep in mind, especially as start prepping breakfast, lunch, all those things, right? Talk a little about this symposium that's going on, the dental symposium, and what that entails.
I'm so excited. This year we have over 350 oral health professionals from all over Texas coming. This is the 5th year I've been the host of it. Dell Children is the title sponsor, and we have 8 different oral health professionals, physicians, and dentists that are coming to speak to us about how oral health actually affects medical health, and medical health affects the dental health. So for instance, asthma is one of the topics that we're going to be talking about. Dental decay is actually 5 times more common than asthma, but it can actually increase your chances if you have asthma to get dental decay.
Wow.
So the medication that they use, the steroid inhaler, will actually dry your mouth out, which is shown to increase dental decay. So after you take your inhaler, the best thing to do is take a drink of water and try to keep your mouth moist throughout the day.
Wow.
So there's a lot of different medical conditions out there that can cause different problems, and this is the point of this conference, is to really get all of the oral health professionals on board and understanding what we can do to prevent dental decay for children.
Yes, and educating the public helps is a huge part of that.
And it's really just knowing that this should not be a problem in America anymore, and it's really on the rise. Preschoolers are getting more dental decay than ever. 3 out of 5 children by the age of 5 have dental decay.
Well, hopefully this will maybe spark some change in some people's habits, parents. I hope so too. Doctor, thank you so much for being here with us.
Thank you for having me. Appreciate it.